As Singapore moves into phase 2 of reopening, should you be out celebrating freedom? Well, before you do that, consider this. There is really very little immunity in the population. Vaccine is still not available. Hence, virus spread is still very possible. Allow me to share with you the spirit approach to phase 2 reopening. Situational awareness, put on your mask properly, isolate the vulnerable, risk assessment. It's really not just about you. Tell others to do the right thing. Firstly, let's talk about situational awareness. There are 3 stages to SA. Firstly, perception, that is, noticing events around you. Secondly, comprehension, making sense of what you're seeing. And lastly, projecting, predicting what is going to happen so that you can react accordingly. Simply put, having situational awareness means knowing what is going on around you so that you can react very quickly. Say you're in a supermarket getting your groceries. Know who is around you and how close they are at all times. If you see someone browsing near to what you're looking for, allow the person to finish and move away before reaching for the items that you want. Or give some indication to the person that you are waiting so that he can move away. Or if you see a worker restocking, they are concerned with getting their task done, so let them. Always keep a safe distance from the person next to you. I know you haven't been out of your homes for a very long time, but when you see sales or things that are very, very attractive, do not be totally engrossed with what you're looking at that you really fail to notice someone getting too close for safety. Next, put on your mask when you have to go out. So you really need to ask yourself, why do I need to wear a mask? Am I wearing a mask so that I can avoid the $300 fine? Or do I wear a mask to protect myself from the possible droplet transmission from others and also protecting others from my droplets? There's a big difference between compliance, having to do something, and desire, wanting to do something. It is more important to do the right thing rather than just doing things right. Learn how to put on a mask correctly and remember to choose a mask that really fits the size of your face. So go find out more online and see how to wear a mask that fits you and protect you. Wearing a mask is really challenging for those of us who wear glasses. But there are a few things that you can do. First of all, ensure that the mask really fits snugly against your face to reduce the amount of air going up towards your glasses. So adjust the nose clip to provide a tight fit. Then wear the glasses over your mask. Another thing you could do is to wash your glasses with soapy water and then allow it to air dry or dab it lightly with tissues. It provides a thin film that prevents fogging. But this is really not recommended for expensive spectacles with expensive coating. Now use a defogger for swimming goggles, and that is what I use, and I really swear by this. It really works. From June 19, you are allowed 5 visitors in your home at a time. But remember, elderly people and those who are immunocompromised are still vulnerable to the virus. So if you have elderly parents at home or a sick member in your family, it is best to continue to keep them away from young children or adults who have been out and about. Next is risk assessment. Many accidents happen in the workplace because people think, well, it will not happen to me. The virus is invisible and silent, and hence many people think the same, it will not happen to me. Whereas people buy 4D and Toto thinking that, well, I might just be the lucky one. So take the 4D mentality towards the COVID infection and think, it could just happen to me. So it is important for you to see the hazard and evaluate your risk of infection. Where are the risks? Big crowds. Close contact with lots of people, and especially in enclosed spaces. Talking, laughing and singing are problematic because it is easy for droplets to spread. Prolonged duration of activity and meeting lots of different people and you have no idea where they have been. And of course, the hygiene of a place. A safety professional will be very familiar with this hierarchy of control in dealing with workplace hazard. Firstly, elimination, which is to remove the hazard. Secondly, substitution, which is replacing the hazard. Then engineering control, which is really isolating people from the hazard. Followed by administrative control, changing the way people work. And lastly, protecting the workers using personal protective equipment or PPE, which is really least effective. So let's try and use this to control the hazard as you evaluate the risk of, say, going out to get something or organizing a party in your home. Firstly, ask yourself, do I really need to do this? If you really don't have to, then don't. Is there any other way that I can achieve my objective? Substitution. Engineering control. So how do I isolate myself and others from the hazard? Is there a way to maintain a safe distance if you have a gathering at home? Any way to arrange the settings or the seatings to keep a safe distance from each other? And then admin control. If you have to go somewhere, can you go at a time where when it is least crowded? And of course, PPE. If you have to venture out, then always wear your mask. And remember that it's really not just about you. There are many reasons for us to stay home if possible. We can stay home for our healthcare workers who have actually done a lot for us. We can stay home for our family members, the people whom we love. There are many reasons. Think of the many reasons for staying home. If those reasons are not enough, then think about this. We have spent 66 days at home since the start of the circuit breaker. Don't let the economic and social cost of shutting down Singapore go to waste. Lastly, tell others to do the right thing. If you see someone not doing the right thing, you need to speak up. If you are conflicted about this, like I was, hey, what if the guy shouts back? What if he causes a scene? Then do this. Prepare an answer beforehand so that you know how to respond to the person. So for example, I would say, hey, I'm a safety professional, I care about safety. Play out the situation in your mind so that you are prepared to respond correctly. Stay calm and walk away if the other person becomes aggressive. But speak up, we must. I watched a video where a healthcare worker said, "We are not your last line of defense. You are the last line of defense." And she's correct. You and I, we are the last line of defense in safety. It really boils down to what you and I choose to do. So I was hoping that using the SUSS Spirit as acronym will help us all to remember to stay safe as we move towards this next phase of reopening. So maintain situational awareness at all times, especially when you decide to go out. Put on your mask and put it on properly. Isolate the vulnerable amongst you, and always do your risk assessment before you decide to venture out. And it is really not just about you, it's about you, and it's about me, it's about us. And if you see somebody not doing the right thing, then don't be afraid to speak up. Stay safe, everybody.